Greetings again from Tucker, Georgia. I'm Mayor Frank Auman, and today's Friday, May the 8th, 2020. I think it's been 3 Fridays now since the last time I came to you with a video update about coronavirus and our response to it and our fight to recover from it as a city. It's also been 2 weeks today since Georgia began to reopen some businesses that had been forced to close due to the pandemic. There are a lot of aspects about the disease and its effect on our community that I want to bring you up to speed about today. So here are some things we know. First, we know that the only real protection from this virus and the only real path to conquering it lies with each of us in our individual personal conduct. That is, how and whether we behave in safe ways will determine to some extent whether we get sick or infected, but it will determine to a great extent whether others get sick or infected. And second, we know that based on the data, the people of Tucker have responded in exemplary fashion. I want to thank and applaud each of you for your personal efforts. Next, we know that this is a really hard subject to talk about. It's hard because the disease itself is both new and complex, and there's an awful lot we still don't know about it. It's also hard to talk about because its psychological and financial and other effects on our families and our communities are also complex. Further, it's hard to talk about because to some extent it's become a polarized discussion where people are perceived as taking sides, which can make it almost impossible to have a reasonable conversation about. Add to that, when you're talking from a public policy standpoint about numbers and rates and risk tolerances, it can seem callous and insensitive when we have friends and family and neighbors who are sick and even dying from this disease. And in our case today, it's especially hard to talk about as your mayor, because it's easy for people to confuse the factors that influence our personal decisions and our personal conduct and the factors that determine our public policy. And those two things, the way we conduct our personal lives and the decisions we must implement as public policy for the benefit and protection of us all, are two very different sets of factors. So I hope you'll hear it all with an open mind, and with the same forbearance I would ask you to show your families and your neighbors and your coworkers and others that you interact with every day. We're all responding to this virus with different emotions and anxieties and levels of understanding and thoughts about what we should do individually and as a community. And within all that, we have to allow room for those differences and acknowledge that no one has all the answers. After all, that's why this disease is such a big problem. No one has all the answers. In our various roles as parents and children and citizens and workers and employers and employees, we have to make lots of hard decisions about how to respond. And those vary widely for different people in different circumstances. That is to say, while we've learned to give each other a safe amount of physical space, we also have to learn to give each other a safe amount of emotional space. As your mayor and as a member of your city council, I and we have to make decisions that make sense for all the people we serve, that consider and allow for as much freedom as possible for individuals to make decisions that are best for them, while doing what must be done as a community for the safety of us all. So let me go back a bit and give some historical context to what we've been doing. The first official public response from the city of Tucker to the coronavirus came in a video from me on March the 13th. That was just around the time major sports and businesses and schools began to close down or seriously consider it. Cruises and spring break plans were being interrupted and canceled. After some days and weeks about hearing about the virus, it was hitting home in many places around the U.S., and we had just learned about the concept of flattening the curve. On that day, I declared a state of emergency for the city without fully grasping what that would become, but knowing that we had to close our offices to the public and begin thinking about new ways of conducting our business. The next week, we adopted an emergency ordinance for the city that gave broad authority and responsibility to the mayor to be able to respond quickly as this or other emergencies developed. Under our system of government, it's a long-established principle that local governments are not only empowered, but duty-bound to respond to emergencies because they're best positioned to know the needs of the local people and places and find specific solutions in real time in the midst of dynamic circumstances. So from that time until April 2nd, all of the emergency response decision-making was in our hands as a city. And with the duties required of me by the emergency ordinance, many of them rested on me personally, directly, with the advice of our council and staff. So generally, my approach was to insist on safe behavior by businesses and individuals. according to the guidelines of the federal government and especially its agencies led by the CDC and the Coronavirus Task Force. With few exceptions, we allowed individuals and businesses to continue operating, but only if and only to the extent they were able to do so while first complying with the safety guidance as it was being given. Many of them, as they and their customers and employees and suppliers came to understand the dangers, chose to close completely, and many chose to cut back drastically. At a certain point, we had to insist certain types of businesses close altogether. During that time, every city in DeKalb and the county itself for the unincorporated areas was making its own decisions about how to respond, and there was a wide variety of responses. Some adopted a near total lockdown approach. Some created lists of essential and non-essential businesses, and those lists were different from city to city, and the county had its own definitions. While some applauded this local control, some were concerned about confusion and lack of clarity from city to city or county to county. At a certain point, many nearby cities that had been championing local control began to change their tune a bit, wanting a uniform response and calling for a statewide lockdown. Once DeKalb County called for a shutdown of the areas in its jurisdiction, many cities decided to follow suit, but others did not. But let me be clear. At no time did Tucker defy or resist or refuse to follow any of DeKalb County's orders. DeKalb County's orders did not and do not apply to the city of Tucker. It doesn't apply to any of the other cities. And whether those cities decided to adopt the same restrictions as DeKalb, they each still decided for themselves. We decided to stay on our own course, and I believe in retrospect and with the benefit of hindsight, we did exactly the right thing. What changed on April 2nd was that Governor Kemp issued an emergency order requiring uniform restrictions for the state. While that uniformity was what so many had been calling for, many of the most restrictive areas found themselves regretting what they had wished for. Governor Kemp didn't go near far enough for them, allowing most businesses, churches, nonprofits, public spaces like beaches and parks, and many others to continue operating if they could do so within strict guidelines. In that way, his order followed the same logic and was much more like Tucker's than perhaps anywhere else in the state. Many cities and counties found their restrictions loosened relative to what they had been doing, and the arguments that began then continue still. We are still operating under a state emergency and bound by the emergency orders issued by the governor. If and when those orders are lifted or expire, Tucker could consider its own emergency order again, extending its declaration of emergency and issuing orders it feels necessary for the protection of the public. But until then, our response is taking a different form. Now, our response is toward understanding the disease, its spread, and how we can support those who are fighting it and our citizens who are having to live with it. While our buildings have been closed, our staff have continued to work diligently inside those buildings and from their homes to meet the needs of our citizens. We've carried on issuing permits, licenses, and conducting inspections. We've maintained an open line to our citizen responder, which is a person who functions something like a help desk, fielding questions and connecting the people who are asking them with the people who can answer them. That's the phone number you've seen on a couple of big billboards around town and on the postcard that we mailed to every business and residential address in the city. We have, of course, been very active on social media, pushing out facts about the disease and the emergency orders, as well as advice on how to care for and protect yourself and your neighbors. Our Parks Department has done amazing work keeping our parks open and safe and providing programming for people to stay healthy and connected, like the Easter egg giveaway and tomorrow night's virtual prom. One of the smartest things we did just 10 days after our first action was to appoint an advisory panel composed of several Tucker physicians and 8 or 10 other members from the neighborhood, business, and nonprofit communities in Tucker. They have been an invaluable resource to me in planning and executing our response, especially as new information comes available and circumstances change. I want to thank them, and I look forward to doing so publicly at an appropriate time. Before we turn our attention to Tucker's response, let me address a couple of other facts and falsehoods for you. Over the last few weeks, the DeKalb and state departments of public health have begun publishing the number of cases in the county by zip code. In each of those publications, 30084 has been in the top 2 or 3 zip codes, which have led some to leap to the conclusion that Tucker has the highest concentration in the county, or even that it's a hot spot. This is what the fact checkers would rate as true but misleading. It's true that there are more cases in 30084 than most or even all other zips in the county, but consider, Tucker and 30084 are not the same thing. Much of 30084 is in Gwinnett County, and some of 30084 is in DeKalb County, but outside of Tucker. Tucker's also the home to parts of, I think, 5 or 6 other zip codes. And the 10,000 or so people who live in Tucker but not in 30084 might object to not being included in Tucker counts, but that data is not being reported. The raw numbers say nothing about when those infections occurred, making them of almost no actionable value. If we had lots of infections a month ago and only a few recently, that would indicate a very different response than if we had just a few in March, but a lot in the last 2 weeks. But they don't report that data. The raw numbers don't account for population, so no rate can be established. Is the number relatively large because there are lots of people in 30084, or because a large percentage of the people who are there are being infected? We don't know. But the most important perspective on these numbers is also the most heartbreaking news. According to the Department of Public Health, well over half of all infections in 30084 have consistently occurred in long-term care facilities, as has been true throughout the state and around the nation. In fact, through May the 6th, we have had at least 126 cases in these facilities, out of a total of 187 cases in the entire zip code. Let me repeat that. Out of 187 total cases, 126 have been in long-term care facilities, and it's hard to tell whether they're even counting staff members in those facilities who might have been infected. That's a big number, and it's something we can help with. Now that more businesses are reopening or expanding toward pre-pandemic levels, we need to be concerned about a second wave and have realistic expectations. Remember that by the time we realized as a nation what a tidal wave we were facing, it was already too late for a containment strategy. So we adopted a flatten the curve strategy. The purpose of flattening the curve was primarily to avoid overwhelming our healthcare system. Unless or until we could get the disease back to a level where we could identify and trace every infected person and isolate them, our best hope was to not let everyone get sick at once. The effort would be to string out the time over which they would get sick. The hope was that would enable our healthcare system to treat everyone who needed treatment and give researchers time to find new treatments, therapies, and ultimately, way in the future, a vaccine. The good news is we seem to be well on our way to achieving those goals. The retransmission rate is well below 1, which means we're getting on top of the spread. Testing and testing availability are way up, and the rate of positive results is declining steadily. Hospital space and equipment are readily available for the most part, and both case rates and death rates are trending downward. The bad news is that the virus has not been eradicated, neither by a vaccine, a cure, or dying out for lack of new victims or herd immunity. Whenever we begin coming out of our isolation, the virus is still there waiting for us, and we have to come out sometime. So whether that was a month ago or a month from now, we still have to take serious precautions for ourselves, but especially for others. We will almost certainly have a surge of some degree or another. The surprise would be if we didn't. The degree will be determined not by emergency orders or law enforcement, but by self-regulation of our personal conduct. Since the state took over all emergency orders, and now that we've settled into the new normal of social distancing and mask wearing and other safety measures, the city's begun to consider how we can best help. Our primary role has been to communicate the facts and the best advice science has to offer about how to avoid and control the disease in our community. The low rate of community spread here is testament to our citizens' dedication to protecting themselves and their neighbors, which comes as no surprise. That's the kind of place we are. Secondly, we have deployed our police and our code enforcement officers to educate the businesses and the individuals in the public about what's required and, if necessary, enforce the governor's emergency orders. All reports are that very little enforcement has been required. Again, not a surprise given the community spirit in Tucker. Now we're focused on two specific problem areas, and we are sending help to both. Governor Kemp recognized weeks ago that long-term care facilities were the single largest source of high rates of infection and death. As the tragedy in Albany unfolded, he and his team innovated specialized disinfection teams, organizing and deploying several thousand National Guard servicemen and women into teams that have traveled the state, giving special aid in cleaning, sanitization, and disinfection to every long-term care facility in the state, many of them more than once. It's been so effective, it's become a national model, and Georgia has trained at least 10 other states in our methods, but those facilities have other needs that we can help with. The second problem is helping our businesses, especially consumer-oriented businesses, get back up to speed in the safest possible way. And part of that solution involves helping customers be confident that they can patronize those businesses at a low risk of infection or spread. And that's another thing we can help with. Over the past few days, I've been reviewing our finances with the city's CFO and other professional staff, and we've identified several programs and line items where we won't be spending budgeted funds due to the virus. I've asked them to reallocate some of those funds for a community response, and next week we'll take the first steps in that. This morning we ordered several thousand high-quality medical-grade masks, which will arrive next week and which we will distribute to 3 groups. Long-term care facilities in Tucker who are dealing with positive cases, local businesses who need to have masks on hand for their employees and customers, and members of the general public of Tucker who would like to have a mask of the highest protective type to wear when they need to go out of the house and into the community. As it happens, next week is National Skilled Nursing Care Week, and their theme is Sharing Our Wisdom. The week is meant to recognize those who are right now caring for members of the greatest generation, the men and women who fought the fights of the last 7 or 8 or 9 decades, and on whose accomplishments and shoulders we stand. The theme is to honor the hard-earned wisdom of our older generations, and it's certainly a good time for them to share their wisdom with us. This virus is only one of the fights we'll have to fight for the generations who follow us, and it's an honor to be able to serve these nurses and the people they're serving right now. It's our hope these masks will not only provide valuable practical help to them and our businesses and citizens, but that it will serve as an encouragement for everyone to better understand what we're up against and to know that we are not helpless and we do not have to be cowed by this disease forever and this silent threat. And I cannot close without special thanks to all of our first responders, which in this crisis includes nurses and doctors and all the healthcare workers, as well as the people taking care of our water supply, our sanitation, our power, and so many parts of our critical infrastructure. You continue to bear the biggest burden other than the victims of this disease. Thank you for continuing your regular duties of keeping us safe and protected, of keeping our neighborhoods clean and safe, caring for our loved ones, all while you bear the additional duties of this crisis and have to take care of your own families as well. We'll never be able to repay you but what we owe you, but we want to be sure you receive our gratitude. And I also need to acknowledge the hundreds of business owners right here in Tucker who voluntarily or under compulsion were called on to sacrifice their incomes and even the businesses they spent their lifetimes building in order to help their community in a higher purpose. We can't wait to help you get back on your feet. May God bless each of you as you fight your fight. Thank you for what you're doing, and I look forward to seeing you on Main Street very, very soon.